When I think back across 3 decades of care and many patients that I've seen, I've been moved by the profound change of many people. My philosophy around health is one that's very holistic. I see that within us is an inherent capacity to be well. It's our nature. And what happens through the course of our lives is that we lose touch with that nature. We lose our alignment with that nature. And so from a physical level, I've watched tens of thousands of people's lives transformed because we've been able to realign them. When I enrolled in Palmer College, where I went to chiropractic college, I had never heard of NUCCA. And along the educational process, I met an upperclassmate of mine, Dr. Marshall Dickholz, Jr. And we became friends, and he introduced me to NUCCA, and he provided my very first NUCCA adjustment. And to this day, I remember very clearly the distinct difference that it made in my life. What makes the Britannia clinic, I think, unique is that we have a very integrated team. When I started the practice, it was focused predominantly on NUCCA care, but what we recognize is that that is an important part, but not the total picture for many people. So the soft tissue care, massage therapy, craniosacral therapy, myofascial work, nutritional assessments and care, supplements and support, those are also very important parts of health and well-being. So we've built a team of very seasoned and experienced practitioners who work very closely together. And again, the uniqueness of our clinic is that we meet and discuss patient files on a regular basis. So there's a sharing of information, and we put our heads together to come up with a solution for a patient where, often we can't sort that out on our own. With new patients, when they come to our clinic, the first question we need to ask is, can we help you? Because we can't help everyone. Because what we're treating is not conditions, we're taking care of people. And what is required, particularly with the upper cervical spine, is a high level of precision to that spine. So we use a very detailed set of x-rays. We analyze those biomechanically to assess and determine the degree and direction of misalignment for that individual, which is always unique to that individual. And then we set out to go about the correction and the complete correction of that spine.
What I liked about the idea of the clinic was the non-invasive adjustment and the care that was taken by Gordon in the clinic here, and the explanation and how they went about treating patients very gently. And that's something that was very important to me after having the injury that I had.
My passion for what I do continues to grow over the years. And it grows because I have a deeper respect and appreciation for the impact that we have on the neurology. We've treated lots of back pain problems, and that's what most people think of chiropractic for. But it's so much more than that. It's about the neurology, it's about the vitality, it's about the expression of our nature, which is the capacity to be well and to really, really fulfill our potential. It's immense. I have young children, and I look at their potential, and I look at their vitality, and I see, when it's compromised. And I know that we can do things to really improve the quality of their lives.